Dr. Elana Miller is a holistic psychiatrist, a trauma survivor, and a writer. Just months before graduating from medical school, Elana's life was derailed by a life-threatening diagnosis. In a curious twist of fate, she received emergency treatment in the same hospital where she had been working as a medical resident, where she perceived a sudden shift as she went from being a medical provider one week to being a patient the next week. She describes the personal impact of this trauma and the bigger realizations that attended this change in her role. Going through this trauma has given her personal and professional clarity and has shaped her identity as the doctor she is today, but not without a mighty struggle during a season of continual trauma. Let's drop into the story.
I'm a cancer survivor. I'm a 2-time cancer survivor. And I was in my last year of residency, UCLA, rotating through the MPH, UCLA, and also the VA, and maybe 6 months away from graduating when I was diagnosed with stage 4 acute lymphoblastic lymphoma. So it was it was just like a very abrupt, serious thing where one day I seemed pretty fine. The next day I was hospitalized and had to stop my residency training. And I ended up having to do chemotherapy for three years and then take some time to recover and like physically and then mentally, emotionally too, in terms of the trauma. Sure. And then I relapsed in 2019. But if the trauma work I did in between my recovery from the first time and then when I relapsed made it like night and day for me in terms of how well I was able to handle that relapse emotionally.
Right. So your situation was facing something as bad or possibly worse when you had the second diagnosis. Let's go back though to the first diagnosis. And can you share with us, how that hit you and what your emotional reality was like when that suddenly became part of your life?
Oh my gosh. I mean, it was like waking up every morning. Is this a nightmare? I mean, it was so abrupt. I was just super healthy, former athlete, like really adventurous, traveled a lot. And I was months away from finishing what was 12 years of cumulative training to be in this profession. And it was like so close, I could almost taste it. And it was just ripped away. And I guess it was just like total disbelief. Like, wait, this can't be happening. And kind of probably for those first few weeks, like every morning, remembering again, oh man, this is my actual reality,
The living nightmare aspect of trauma.
Yeah.
That shock originally. And it really, derailed you for a time and changed your whole life course because you had to be about treatment.
Absolutely. And I mean, it was it was a lot of things. I was in a relationship with someone I'd been dating for 5 years and so very serious. We were living together and that unraveled within 6 weeks of me getting diagnosed. It's just one of those situations. It was so extreme and not everyone's going to handle it the same way. And he didn't handle it super great. And so it was like, not only losing work, it was like this whole future I'd worked toward, my career, this relationship I thought and hoped would turn into marriage, my health, just every plan I had for myself was all of a sudden not happening.
Was ripped away. And what was your kind of thought at the time or your emotional reality about these sudden losses?
Oh, I mean, it was just like not computing it, I guess. I mean, the thing is the treatment. Okay. So the treatment itself was so hard. It was just like a very rigorous chemotherapy regimen. I mean, I was getting I had to be hospitalized for the chemotherapy. It was so intense. I would spend weeks in the hospital. And then after maybe 6 weeks, it switched to outpatient, but still I was going into the clinic 5 days a week to get chemo. And I mean, it wasn't one infusion every 6 weeks or something. And so I mean, for a long while, it was just thinking about getting through the day. And I don't think it was until after I finished chemo that it kind of hit me of like, oh my gosh, now I have to get better. And that actually, honestly, that was even more terrifying. Going through chemo, at least I had a job. It was like
right. You're fighting for your life.
Yeah, it was like, wake up, go to my doctor's appointments. It was just really clear what to do. But then when I finished chemo and then I wasn't seeing the doctor so much anymore, and there was just like this gaping void where I was like, whoa, my gosh, how do I even think about starting to rebuild what I had before?
Right. So in a way, like the trauma didn't fully hit you until after a bit of a delay, because you're fighting for your life at first. And there was this sort of state of shock. And then when you had more time to think and less structure, that's when a lot of the trauma may have hit you.
Yeah, that's exactly right. Yeah. It was just like that void of, oh my gosh, time. What am I supposed to do with it?
Yeah. And, thinking about your identity, I mean, you had worked so hard, 12 years, and a relationship you had built for 5 years, and all of that changed, overnight, as you've explained it, as well as you went through this interesting shift of, being a doctor to patients, to being the patient in the scenario. Could we talk about how, that shift was for you and what you observed?
Yeah, it was very strange. I mean, so first of all, when I was hospitalized, I was hospitalized at the place where I trained. And so it was this, like, I kind of knew some of the people treating me, but more as like colleagues. And it was just like this very, strange, like flip. And it was almost like I didn't feel like Dr. Miller anymore. I became Elana. And like, I remember even correcting some people who called me Dr. Miller. I'm just like, I'm Elana. I mean, also it was kind of an informal, I mean, I don't have like something about people have to call me Dr. Miller, but it was almost like I felt uncomfortable when someone called me Dr. Miller. I felt like a fraud because I didn't feel like I was a doctor anymore. And I actually had this one interaction, I would say like 95+% of my interactions with doctors were like very positive. And I feel fortunate for that, because I know it's not the case for everyone getting with a lot of medical problems, cancer, and just getting a lot of medical care. But like, I had this memory of this doctor like not treating me super well, not believing I had pain, not wanting to think you didn't want to prescribe me pain meds. And I didn't realize until after I left, I was like, I don't think he knows that I was a doctor. Like, he was kind of being very patronizing and kind of like trying to say I had a psychiatric issue. So I definitely think he didn't know I was a psychiatrist.
Yeah.
and so it was, I kind of lost my identity as a doctor. And I have actually this memory of when I finished training, or finished chemo, like years later. I was at brunch with a friend. This was like 3-4 years later, trying to put my life back together. And I just heard his voice, like, Dr. Miller. And like, no one had called me Dr. Miller in years. And I kind of turn, and it's a patient I had seen back in residency. And she was telling me like how much I'd helped her and stuff. I was like, oh my gosh, I forgot I used to be a doctor. And so I remember that encounter kind of was very like, it was very nice to have that kind of reminder that I had once been a doctor and that I would once again be one.
Yeah. Yeah. And I would have liked to see the look on that doctor's face when he realized that you were a psychiatrist. And
actually, no, right?
Yeah. But if that can happen, right, to you when you're not in your gown and not in sort of like your official uniform, it can happen to any patient. And so that was eye-opening for you as you've thought about the doctor-patient relationship and what patients really want. I thought you had some really good insights on that. Can you share a bit with us about that?
Yeah, I mean, it's interesting. Like, I learned in my medical training, kind of provide standard of care, that maybe includes medication or therapy in my field and all that. And actually, it's interesting that story I told about that patient who came up to me. Oh, do you remember me? She was basically saying, like, you helped me so much. I've never forgotten it. And I thought back and I was like, I remembered her, and I had only, to me, done something extremely insignificant. I kind of just reassured her about it was okay to take this medication she was taking. But for her, that was so significant. And like the same thing happened for me too, even as a doctor and understanding things like standard of care. And the memories that really stick with me about my treatment were not like, oh yeah, I remember when I got that perfect dose of chemotherapy and everything. I mean, obviously I'm extremely glad I got all that, and that's saved my life. But it was like just being treated with such empathy by my doctors, and especially my oncologists, that kind of like kept me going through something that was really difficult, that was really hard to keep showing up for chemo, that was just like taking poison. And like, I didn't want to do it sometimes. I was like, please don't make me do this anymore. And like just being cared for. So I think about that a lot with my patients. You know, it's both like, what do I think they want, but what do they want? And sometimes those are not the same things. And you have to like give patients what they need, but also like give them what they think they need. And often that's just warmth and empathy and reassurance that you're listening to them and care and concern.
Yes, definitely. I mean, I definitely agree with you on that. And the way that your trauma showed up would make that very important, because what I know is that, your trauma showed up as kind of an absence of feeling things, a kind of inability to feel joy or other positive emotions. I'd love to get into that part of the conversation about how standard of care, the first line treatment that we offer isn't always the best treatment for everybody.
Yeah. I mean, it's funny because I treated PTSD prior to getting cancer. It was like one of the things I focused on in residency, but I didn't recognize it in myself. So I can only imagine for people who aren't trained psychiatrists or therapists trying to recognize PTSD in themselves. It's really hard because sometimes for me at least, it wasn't something that was dramatic. Like I wasn't having nightmares, I wasn't having flashbacks, but it was this like needling all the time of like, my brain is not a safe place to go. And it was like little things, a commercial came on TV for like St. John's Cancer Center or something, and I would have to turn off the TV. Yeah. Or like I remember having this memory of being like now I'm married. My husband I met, who I was still on chemo, being at his family's, and we were watching a movie, and it was not even about cancer. It was about someone being really sick, a young person being sick in the hospital. I was like, I've got to go home. It was just this like, I can't think about this stuff. And so it was kind of like just everything kind of was like suppressed, and I was kind of numb. So I wasn't depressed. I wasn't horribly anxious. I was just kind of blank. And I didn't have the same joy for my life that I had prior to having cancer.
Well, I think to your point, sometimes we have this image of what PTSD is, and it's this thing that's been portrayed in movies and books as, coming with these startling, intrusive images or nightmares. And that's not always the case. I really think what you said, I want to really pull out and just say it again, because I think it's going to be very helpful to a lot of people who suffer from trauma, which is, it wasn't something dramatic. It was this pervasive feeling of, my brain is not a safe place to go.
Yeah, exactly. And it's interesting. That's, I think, why I had trouble recognizing it in myself. And I think probably why a lot of your listeners maybe don't feel like they deserve to have PTSD or like, oh, I don't really have PTSD. And maybe they minimize what they're like, how difficult it is, what they're going through. Because it's often not what's portrayed in movies and stuff, which I mean, you can kind of understand because it's movies dramatize things, but it was just it was more like an absence of something for me than the presence of something. And it was also like a distorted belief system. It was just like, oh, I could just die any day. And at that point, I didn't have a good reason to think that I was going to relapse. I actually had very good reason to think that I was cured. And but I had this like very specific idea in my head. I was going to die at 45. Like I was 35 at the time. And I was like operating my life kind of, I was like, oh, I have to do everything I want to do in my life in 10 years. So I was like working really hard on my practice. I now have a private practice. And like, so my behavior, like in my whole kind of mentality toward the world was like very distorted. And I didn't even realize how distorted it was till I got help.
Yeah. So a lot of patients, I'm sure of yours as well, have described this feeling of being kind of hunted by something, with this sense of like, my future is not that long. So there's like always this urgency about things and this pervasive sense of dread, which is a type of trauma expression. And for that type of trauma expression, in your case, prolonged exposure was empowering for you. Talk about what you gained from prolonged exposure, and maybe let us into that space a little bit, as much as you're willing to share.
Yeah, definitely. And I know it's not an approach that works for everyone. And I think for me, because that's what I was taught, the modality I was trained in doing for patients in residency, and I really believed in it. I had a really excellent supervisor who taught me prolonged exposure. So I was like all in on the concept, so that when I realized, oh, I have PTSD, I sought out a prolonged exposure therapist. And I was just like, I get how this works. I believe in it. I want to do it. But it was difficult, but I would say it was extremely difficult, but I got better pretty quickly. And what it was is like in some people's trauma is like a single event, but I'd say most people's is kind of something that happened over a span of time, or there's like multiple aspects. And
I agree.
Yeah. It's like, and so we wrote down with my therapist a list of kind of the worst memories of like, so of this 3-year experience, there was maybe a dozen specific memories that were just the absolute worst that I really was avoiding even thinking about. And it's funny, what I learned when I was doing prolonged exposure on patients was to start kind of with like a middle memory, like not the hardest, not the easiest. Right. He kind of was like, I actually, if you're on board with this, would like to start with the worst, like just get it out of the way. And because then it makes everything else easier, like kind of rip off the Band-Aid approach. And that really worked for me, because I was game for it. And so, like that first appointment though, where I'm talking about the trauma and reliving it kind of in present moment, I would close my eyes. I would describe the scene of what happened, like I was writing a screenplay or a novel, like all the sensory details, kind of with the intention of feeling like I was reliving it. And I mean, it was like terrifying. I was crying but then the next time I went in to do it, I was like, oh, it's still hard. It's not as hard. Yep. And then the next time, this is not so hard. And so I didn't get better overnight, but pretty quickly, I at least felt that initial encouraging feeling of like, oh, wait, I'm more capable to face this than I thought I was.
And I think prolonged exposure does work for some patients. I would say, in my experience, and I think you had noticed the same, that it's a hard sell for patients sometimes, and they often drop out. That you had 2 advantages that many people don't. And I've been thinking about this since we had kind of other conversations about PE. The first was that you had seen how it works on the whole trajectory of how people get better. So because you had done it and been trained in it, you didn't have to sort of take it on faith that if I go through this experience, the body will calm and I will habituate and it will empower me in the end. That was not theoretical to you. It was something you had seen and taken people through. And I think a lot of patients, it can be really, as you said, terrifying and perhaps a bridge too far. And then I think also the type of trauma exposure that you had created a kind of trauma symptom of, the absence of feeling something. Numbness was a strong thing in kind of your symptom profile. Whereas, you and I both had patients where they're so overactivated that
Yeah.
to do prolonged exposure can put them into a state where I'm thinking, I don't know if I wanted to send them out on the freeway to drive home. Have you
Yeah.
had different experiences with different types of trauma patients?
Yeah, I mean, I would say that sometimes they're like we'll end up doing prolonged exposure, but there's like some preliminary work we do first because right, if someone's just so on the edge in terms of their nervous system, you kind of like know that they're going to get worse before they get better, and you want the patient to be on board with that and be ready and not be so on the verge of just feeling like they're going to lose it. So we build up to it over time.
Yeah, you can make different choices. Mm-hmm. Yeah, go ahead.
Oh yeah. And I was just going to add this other thing. I think too, because I was thinking about this also since our last conversation. And I think because I have received prolonged exposure therapy, now when I'm doing it with patients, I'm like extra convicted.
Yes.
And I'm extra confident. And I think that makes the patients more confident in the process and more like willing to trust me, kind of like maybe suspend their disbelief. Because I think if like you're working with a therapist who doesn't have like total belief in it, they're gonna back off in kind of facing it with you because maybe it's going to be scary to the therapist. But I think with everything I went through, I'm like, whatever you went through doesn't scare me. I'm here with you for whatever this is.
Well, I definitely agree that the therapist level of anxiety is a huge factor that we don't look at enough in how treatment outcomes play out. And there are some patients like I had, and not always Marines, but I treated a number of Marines and they were, you use the phrase rip off the Band-Aid. They were rip off the Band-Aid, show me the hill to take and I'll take it kind of people. And so for them, prolonged exposure was sometimes a good fit. For others, it just wasn't. And, I had to kind of think really hard about different approaches and sort of landed on sequencing matters for some people, getting them calm in their own bodies, treating the biological injury so they can approach it with confidence. It really makes a difference for some people. But we totally agree on, the therapist interaction with the patient, and not every, treatment works for every single patient.
Yeah, absolutely. And like you said about sequencing, I totally agree where some pre-work, however that looks for that individual patient can help whatever the exposure is, whether it's prolonged exposure or just the person going back to doing things that they were previously afraid of, like just kind of resuming their life. It helps that feel like an empowering experience rather than a terrifying experience. Like the idea is that it's a therapeutic experience to face your fears and feel like you did it successfully.
Exactly. And, speaking of empowering, I wanted to get to the place in your story where you had the recurrence and a second diagnosis. But the thing that you said to me, I could go through it now because I realized that I wouldn't be the same person this time. Can you talk about that and how the therapy really shifted your experience of that second round, that second battle with cancer and your identity and really anything else?
Yeah, I remember so that was something my therapist had said to me, the guy I was doing prolonged exposure with, because I was telling him, I was like, and this ended up being maybe 4 months before I ended up relapsing. I was just saying how terrified I was of relapsing, just like kind of consumed with this fear, like that I couldn't go through it again because it was so hard to go through it the first time. And I felt so like just weak and totally broken by it. And I'm like, I can't do it again. He's like, well, even if it happens again, you're not the same person. So it won't be the same experience. And that just was like a light bulb that went off. I'm like, oh yeah. And there's something else he said. I was like, I feel like I'm never going to recover or something like that. And he said, like, well, you already did. Like, you're here. And I was like, yeah, you're right, actually. I mean, it just kind of happened. I did get through it. As awful as it was, it's ended. And I did end up on the other side of it. So even though it didn't feel like I was getting through it, when I looked at it kind of objectively, I did. And it was at that point, I'm like, well, if I got through that, what can't I get through,
Right. Like, what does it mean to recover to you in that context now?
Like that time, it was more just that I was like sitting on his couch. It was like a very literal, like I'm still alive sitting here.
I'm still here.
but now it's just, I could say honestly that I don't really think about having had cancer. It's not even really a form of a piece of my identity. And I mean that in a good way. Like I just live my life like it happened and it's over. And nothing lasts forever. The best things don't last forever. The worst things don't last forever. And it's like people talk about, oh, you developed into like this ethereal evolved being because you went through this. And I'm like, actually to me, what is so reassuring that I kind of went back to being the same person I was before in the best ways, but with just a little extra wisdom.
Interesting. Before the cancer, before cancer. Yeah. Yeah. Interesting. So it did kind of give you some perspectives on things, but it stripped away some things as well.
Yeah, I mean, I when I say like I became the person I was before, I mean kind of in a good way, because I was very positive and happy I have a more, I guess, more confidence, like more like my sense of self, I think, is less conditional, because like everything that my sense of self was based on, I lost temporarily at least. And so I had to figure out something else that was good about me other than, being smart or working or being attractive or having this relationship or, the identity as a doctor. And like that, a core sense of self, something that can never be taken from me, is that I survived that. Yeah.
Yeah. I think that's critical. That is a critical insight that trauma can, when I say strip away, I mean, strip away those, how do I want to put it? Those things that our identity can be propped up on that aren't really who we are at core. It can really carve us back to who we are. And, in the study that I did years ago with people who survived bone marrow transplants when people often didn't, that was a common theme. You and I both believe in post-traumatic growth, and people say, well, what is that? It's not just theoretical. It's, you can come away from a trauma stronger, more confident, more clear on who you are and what your values are. And I think your story is a great example of that.
Yeah, that's how I feel. I mean, I just feel like I went through something and survived something that's not, like, I'm proud of how I'm proud of myself, of how I handled all of that. And it wasn't hard. The thing is, people found me inspiring because I was like, oh, you got cancer. I'm like, that was just bad luck. Like, and then surviving was good luck. You know what I mean? Because a lot of people don't survive. Like, so to me, all that was luck. But then what I did after, I was like, I lost everything, but you know what? I'm going to rebuild it. Like, that's what I'm really proud of that I did.
That's awesome. Yeah. To me, that is definitely something to be proud of and something nobody can take from you. You will always have that.
Yeah, exactly.
So tell us what you're doing now, because, you're in practice and you're Dr. Elana Miller, and tell us what you're up to now and where people can connect with you.
Yeah, so I have a private practice, although my practice is full right now. But what I'm doing is I'm training and mentoring other psychiatrists to do what I do in terms of the treatment modality that I use. And I practice integrative medicine. You touched on that a little bit in the beginning, but things besides just saying medication and even therapy, like there's lots of additional holistic tools that are available. And so my website is zenpsychiatry.com. So that's where kind of my home base. I have a blog, I have social media, and so I link to that all on my website.
Well, thank you so much, Elana, for coming on and sharing with us. I think this is going to be an awesome addition to our series that will shine new light on what trauma is, how it impacts us, and how we can come back stronger than we were before we were hit by trauma.
Yeah, thank you so much. It was great doing this with you.
Thank you. I'm sorry you have cancer. 5 words that can change our entire existence, not just the day-to-day ways we spend our time as we fight for our health, but our entire identity and sense of how we fit into the world. Before the trauma of cancer surfaced in her life, Dr. Elana Miller knew PTSD. She had treated many patients who had PTSD symptoms, yet she didn't recognize PTSD within herself at first. As we've seen and will continue to see in future conversations on this podcast, the difficulty putting ourselves in the frame of suffering from PTSD is a common thing. Once she did adopt the identity of a trauma sufferer, she pursued physical and mental health with the same drive that took her through Harvard as an undergraduate and USC, top-tier medical school. Transitioning so suddenly from being a provider to a patient helped her see that the world cannot be divided into these 2 categories. We all suffer, and therefore we're all patients at times in our lives. One of the things that makes Dr. Miller so exceptional is that as she has adopted a new identity as a trauma-informed psychiatrist, she recognizes that treatments considered best practice by the field at large may not be the best practice way to approach a given patient. This is one of the long-term impacts of her trauma, her sensitivity to important differences among individuals, and her agility in treating them in trauma-informed ways. From a doc to a doc, I wish her all the best, and I'm grateful to have had this conversation with her. Post-traumatic stress is not a life sentence. Trauma can be healed with the right insights, the right treatments, and the right support. The story of our trauma is presented by Stella. Visit www.stellacenter.com to learn more about Stella's breakthrough trauma treatments. Please share this episode with people you care about who have been impacted by trauma. And remember to subscribe on Spotify and other streaming platforms.